Good morning to all of you. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Now, urticaria is characterized by a round rash on the skin that can itch a lot. It may be due to chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the cause is even unknown. So, as per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. So, urticaria is classified as acute and chronic. But the most important part is not to ignore it, and doing self medication can worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its type, how we can prevent it, the kind of test required for its diagnosis, etc., etc. So today we have with us renowned dermatologist Dr. Swarnalatha, who is a DDVL MBBS dermatologist. She is a popular medical and aesthetic dermatologist based out of Bangalore and has been practicing since 2012. She completed her MBBS and post graduation in dermatology DDBL both from Guntur Medical College. It's and she has also worked as zonal head Karnataka at Colors Healthcare. It's such a pleasure to have you with us, Dr. Swarnalatha. A very warm welcome to you.
Thank you so much, Samyukta, for that introduction. I am
So,
Dr.
Doctor,
Swarnalatha. Yeah.
yes, yes.
Hello everyone. I'm Dr. Swarnalatha, practicing dermatologist in Bangalore for the past 12 years. And a warm welcome to all who are attending this session on urticaria. Urticaria is a very common skin condition in our OPs. So let's look into it, and I'll try to clarify and create some awareness on urticaria. So, yes, let's start.
Yes, absolutely, Doctor. We are really looking for a very informative session. Now, Doctor, urticaria is quite common, and many a times, most of us get it. Either we know about it or don't we get it, and it's important to understand and have information about the skin condition so that in case we or any near and dear ones get it, we know what is the right way to get it treated. To start with, Doctor, what is urticaria and how it is characterized?
Urticaria is a very common skin condition. Usually people know it as hives. This is a type of skin rash which is triggered by some reaction to food or any medicine, or sometimes any irritants also can induce urticaria. And most of them will present in my OP. Usually they present with this red colored bumps all over their body. They will be red raised rashes all over the body. And usually most of the times they will give this history of consuming some food, especially seafood, and also sometimes a recent illness, and they were on some medication, and after that this has started. This is usual history I get from my patients of urticaria. But most of the times it resolves on its own, or with a stacked dosage of antihistamine or medication. But at times when it becomes chronic or recurrent, when it is repeatedly bothering the patient, then we have to dig into the root cause and treat them appropriately.
Right. So, n number of things can cause urticaria. It's important to understand what is triggering, what is the cause, and then treat it. So, it's important to go and get it treated by a qualified dermatologist. Now, Doctor, initially I also said in the introduction part that urticaria can be characterized or categorized into two broad sections: acute or chronic. Please shed some light over that.
So yeah, so urticaria it is characterized. It has a characteristic lesion called as wheals. So the wheals are the characteristic lesion of urticaria, the presentation. So what are these wheals? Wheals, they are like raised, well circumscribed erythematous and edematous. Erythematous means red and edematous means swollen. So this well circumscribed red and swollen lesions are the characteristic lesion of urticaria, and usually they are very itchy. And the patient may experience wheals on the some part of their body, and then gradually it just spreads to the entire body, or sometimes some part of the body gets the lesions, it starts resolving, and then slowly the other parts gets involved. This is how it usually happens. And also there is another severe form of urticaria where internally the mucosal areas are getting involved, which is called as angioedema. So in this angioedema, what happens? There will be like swollen lips, swollen tongue, or sometimes larynx or bronchospasm. That is internally in their lungs, or like the tubes in the lungs also get inflamed. So this is something severe form of urticaria. So they will have chest discomfort and breathlessness. So these are like different types of like presentation of urticaria, and also there is one more condition called as dermatographism or dermographism, where even with a slight pressure, pressure on the skin, it leaves an impression of that particular pressure, and it causes that urticarial wheal in that shape. So, so these urticarial wheals can be like they can be linear, they can be circular, or they can be arcuate. And also, depending upon the duration of the presentation of urticarial rashes, it is divided. It is categorized into acute and chronic form. So acute form is like when the rashes are less than 6 weeks duration, it is called as acute urticaria. And when it is like more than 6 weeks duration, it is called as chronic urticaria. Again, in chronic urticaria, we have like chronic spontaneous urticaria or a chronic inducible urticaria. Spontaneous urticaria, it can occur because of some physical factors like extreme exposure to heat or cold, or this pressure urticaria, or any exposure to chemicals or irritants, or any underlying autoimmune conditions. All these can lead to this kind of urticaria. And induced urticaria is some of these are like which are induced with like cholinergic urticaria or contact urticaria, aquagenic urticaria. These all fall under the induced urticaria. So, but broadly, usually what how we classify it is like acute and chronic. That's how the treatment plan also like depends on the acute and chronic urticaria. Acute is like less than 6 weeks, and chronic is more than 6 weeks.
Right. So acute is like less than 6 weeks, and chronic is more than 6 weeks. And of course, the line of treatment depends upon what category the urticaria falls into. Now,
Yes.
doctor, what studies are performed on the evolution of urticaria? Are there any studies?
Yes. See, urticaria, especially when diagnosing urticaria, the clinical presentation itself gives us the clues. So when the person comes into the clinic, so we see like they will present with these raised lesions, the red lesions all over the body, all of a sudden appearing after consuming some food or some medication or recent illness or something. So they will present with those particular like the specific characteristic wheals on their body. So clinical presentation itself gives us the clue. And when in case of acute urticaria, usually we don't perform any studies. It is diagnosed clinically, and when we give that dosage of antihistamines, it resolves. But when it is recurrent or chronic, that is, it is extending beyond 6 weeks. Then the investigations or the tests play a role here. So basic lab tests like your complete blood count, your ESR, and thyroid TSH, thyroid profile, or any antibodies like ANA or RE factor can be done. And most of the times it depends on the history of the patient. uh, I usually advise my patients to just follow a food diary, to maintain a food diary, so that to observe carefully which is like when it is being triggered, to maintain what they have taken or what they have consumed in the past few days, or which medication they have taken or what they have got exposed to. So this observation, the self observation especially, plays an important role to coming to a conclusion about the triggering factor. So identifying the triggering factor is very very important. But sometimes we need some tests, like specific tests, like in case of chronic cases, allergy testing with the skin prick test. This test identifies the allergens, especially in case of chronic urticaria. And there is a test called as radioallergosorbent test. It measures the IgE levels, which are also elevated in chronic urticaria. And atopy patch test. This measures the skin sensitivity, the skin reactions to particular allergens. And when we are suspecting something autoimmune, then there are some specific tests like autologous skin serum tests or lymphocytic transformation tests. So these are certain tests we perform to specifically identify the factor that is inducing this chronic urticaria. And in case of urticarial vasculitis is a type of is a type of urticaria where the blood vessels are also involved, and the wheels will be tender. They will be painful also, along with the redness and itchy. So in such cases, in case of urticarial vasculitis, then we need to perform biopsy as well, skin biopsy as well if needed. So these are some of the tests, but most of the this diagnosis or most of the treatment plan will depend upon the history given by the patient and clinical observation.
Right. So this was about what studies or tests are performed for proper evaluation of urticaria, and in case of acute urticaria, mostly taking histories, clinical investigation. They work. In case of chronic, of course, some tests are recommended.
Yes.
Now, doctor, what are the treatment options available for urticaria?
So there are n number of actually precipitating factors. There are n number of causes or triggering factors that cause urticaria. So
Mhm.
when we come to acute urticaria, it can be because of food or any medication. Recent travel history is also very important in case of urticaria. And if they are handling any pets, or they're just coming across any dust or molds, or if they're handling any chemicals, detergents or creams or lotions, all this history is again important. And in case of chronic urticaria, we need to know about their autoimmune status, any autoimmune disorders, or any medical illness. All these things like play an important role. So the treatment, when we come to the treatment part of urticaria, treatment options is like, it is the main thing is to alleviate the symptoms, because they will be having aggressive itching all over the body. And aesthetically, when they keep seeing like the swollen face, like lot of red rashes on the visible areas, which will be little depressing for the patient. And when it turns chronic, definitely it forms one of the major cause for the depression also in some of the patients. So giving some relief from the symptoms and also preventing the recurrences plays a major role here. And to address the root cause, why it is actually happening, and to correct it at that level is very very important in the treatment of urticaria. So usually when the person presents with urticaria, I prescribe antihistamines, that is anti-allergic medications, and also sometimes if needed we have to prescribe corticosteroids. And when there is severe reactions like angioedema, as I said, like chest discomfort, swollen tongue and lips and all that, then maybe epinephrine injection might be needed. And when it is chronic and chronic urticaria, and it is not responding to any of the condition, like any of the treatments like antihistamines or corticosteroids, then there are other options, being like immunomodulators can be used, and biologicals also can be prescribed. But it is in chronic urticaria, one thing needs to be kept in mind is that it runs for a longer duration. Patient and the doctor, it tests the patients of both. So like following the proper instructions and going through the treatment for long duration is very very important. And also to control itching and to soothe the skin irritation, we will the first choice would be usually calamine lotion because it immediately soothes the skin. Sometimes some mild steroid creams or topicals will be prescribed. And cold compressions, they will also give some relief from the irritation that is happening on the skin. And most important thing in the treatment of urticaria is avoidance of the triggering factors plays a major role. For example, if they understood that specific group of foods or specific group of medications are triggering their reaction, then avoiding the triggering factors plays a major role in the treatment of urticaria. And also dietary changes, certain dietary changes like sticking to something bland. Don't go with spicy foods and fried foods. Stick to bland foods and try to include more probiotics, because when there is gut inflammation, when the gut in your when the gut is inflamed, it will also transmit the inflammatory mediators into the blood, and that will also reflect as reactions like this urticaria on the body. So, to control that, we need to include probiotics in your diet. That is very important. And maintaining good sleep and balanced diet and moderate exercise. So, all these lifestyle modifications, dietary changes, and avoidance of triggering factors, they play a major role and help in resolving the issue, and also help in treating the condition at a faster pace. And in case
Fair
of
enough.
emergencies, for
Yes.
example, if at all they're present with angioedema, there is they have like chest discomfort, breathlessness, and all that. Please don't self-medicate. Then immediately injections, like certain injections of corticosteroids or epinephrine, has to be given. Sometimes hospitalization is also needed in case of severe reactions. So then you have to immediately rush to your nearby hospital emergency department.
Right. So you need to be very careful in case you are a patient of chronic urticaria. Please continue the medication as prescribed, as instructed by the doctor. What happens, doctor? I'm sure you also get patients
Yes.
like that who'll do it or follow the prescription for maybe 1 month, 2 months, and then stop it because now they are seeing some kind of relief. And then again, in case they see the lesions, because they have the prescription with them, they'll go get the medicines again and start it all over again without keeping the doctor in the loop. I'm sure you also see such cases. So, what is your advice? As you said, it's very important to have
Yes.
patience from both the side, from the doctor's and the patient side. So, how important it is to follow the prescription.
Yeah, so you take like not only chronic urticaria, you take any chronic skin conditions. Follow up is very, very, very important. That is why I'm stressing upon don't self medicate, because the course of the disease we don't know, we can't predict. Sometimes, like maybe after taking the medication for 10 days, and after that they will stop it. Like they feel the relief of symptoms and they don't see any rashes. They feel it's all fine, and they'll stop taking all the precautions, and they will start they'll just get back to the normal, and they will not have the follow-up visit with the doctor. And I have come across of course like a lot of people coming again with even more severe form of urticarial reactions. So this has to be stressed upon, that like the follow-up with your dermatologist is very, very important. And don't stop your medication on your own, or don't start any other medication if somebody says, like just don't start it as such. This has to be properly investigated, especially in case of chronic urticaria cases. This has to be properly investigated, properly followed up, and proper treatment line has to be followed as per the doctor's instructions.
Right. Doctor, skin is the largest organ of our body, but still, I think we are very lenient. We love doing experiments with our skin. In case of any skin infection, reaction, allergy, before going to a doctor, we'll take advice from everybody else, our friends, relatives, neighbors, Padavadi auntie, Then we have nearby chemist shops, and we are so obsessed with the over-the-counter topical application, over-the-counter medication. Now, because urticaria is a kind of allergy, and people are so aware these days, information is everywhere. So they'll simply go take some anti-allergens all by themselves, and because they'll get relief for some time, they feel that they had treated the problem. How dangerous it can be if we go for self medication, self topical application, or go by others' prescription. For example, a friend had urticaria, and many a times they share their prescriptions with their friends, relatives, etc. It's again very common tradition in our society.
Yeah, this is a serious issue, especially when they land up in some angioedema or anaphylactic shock. So then it's a problem. So usually on friends' advice or somebody has told like to take some cetirizine or levocetirizine, this has become like they're available OTC and they will just take some tablet and they feel like okay, and then like all of a sudden don't know the allergen can just spike up and then they can land up into any emergency. It can be they can faint, they can have a syncope, they can have an anaphylactic shock, and anaphylactic shock, it has to be treated immediately. So in such cases, self medication or just taking some advice and gulping on some medication is really very bothersome. So rushing to the hospital and getting properly tested and treated by your dermatologist is very very important in case of urticarial lesions, and especially in kids. Uh, Kids also do present. Acute urticaria is common in kids because of the worms in their stomach or like exposure to different kinds of foods. They will also have this kind of acute urticarial lesions, but always make sure that you just like you visit your doctor, you get it examined properly, you make sure that it is diagnosed, and also the triggering factor or the aggravating factor is observed and noticed and it is addressed by the doctor, so that the anti-allergic because all like cetirizine will not work for everyone, levocetirizine will not work for everyone. So there are different types of antihistamines, different types of steroids, different types of medications and topical applications which are like destined to treat different types of allergies. So this has to be addressed by the doctor, this has to be treated by the doctor. This awareness is very very important, otherwise we'll land up into trouble. See the anaphylactic shock, like there are cases where with urticarial anaphylactic shock people like have lost their lives because they have just simply self medicated or they have neglected. So this is very important to visit the doctor, to visit the emergency department if at all you present with any of these conditions of angioedema, or even if it is normal urticarial rash also, you have to visit the dermatologist and get it examined and get it treated by your doctor.
Right. So urticaria is a condition where the rashes itch a lot. It's not a very comfortable scenario with the patient. They are in so much of pain and annoyance, irritation, because they are continuously itching. At many a times they stop socializing or going out in public because they just don't feel, fit for that. So it's important to talk about it. It's important to go to the right person, which is a qualified dermatologist who will help you in getting relief, get it treated. So as soon as you see these hives or lesions, please go and consult your doctor. Please do not self-medicate or talk to your family relatives. Talk about it, but talk about it in leading to the right path, which is taking you to the doctor. Now, Feroz Khan is here, and his question is: are there any preventive measures I can take?
Yes, preventive measures as such, acute urticaria is unpredictable because it is the first episode you're coming across and we don't know what exactly caused your condition. Acute urticaria usually it resolves. It resolves on its own or with a initial dosage of your whatever the antihistamine or the steroid that has been given to you. It resolves. It's not a huge thing. But when it is turning chronic, yeah, you have to like the patient education here. Counseling plays a very major role. So we have to counsel them regarding to maintain, as I said earlier, to maintain a food diary, to see like what exactly is triggering when you're having a kind particular group of foods, or when you, especially these kind of medications like penicillins, NSAIDs, these are called as analgesics. We usually take like the painkillers. So these are the common group of medications, and sulfonamides are the group of medication which can cause urticarial lesions. So we need to notice like whether they have been under those medications any time in the any recent times, or any particular group of food consumption is just resulting in this, or how is their gut health. This is also important. So preventing these, whatever we have to identify the triggering factor, and avoiding that is important to prevent further lesions, because in almost 80 to 90% of the cases, chronic urticaria cases, it becomes very difficult to come to a conclusion about the triggering factor or the causative factor. So in such cases, balance whatever maintaining a very good balanced diet, like including more of bland food, and avoiding all the chemicals or latex, rubber. There will be like thousands of things like around in our day to day life which can trigger. So identifying the causative will become very difficult to come to a conclusion, especially in chronic urticaria cases. So we need to be like, when we understand that it is extending more than 6 weeks and we are not able to identify specifically, then we need to be careful about handling things like chemicals or any irritants or any new creams or lotions as such. And when there is any travel history also, you need to observe about it. And deworming can be done, because sometimes worms in the stomach can also trigger urticarial reaction. So deworming can be done, and avoiding the foods which are allergic, which have that allergic tendency. So those foods like nuts and eggs, tomatoes, so we can avoid them in our intake and reduce the quantity of it. So these are the most common things we can take
Preventive
care.
measures.
Well, yeah,
Yeah.
that is what.
And doctor, before we sum up the whole session, any take home message for our viewers?
So yeah, so urticaria is definitely is very depressive, because when it becomes chronic, I have seen my patients, I have seen my close relatives who have gone into depression because of the urticarial lesions, because every day in and day out they were getting one or the other lesion. They have been on some regular medication for so many months to years, but still they keep getting the lesion. Sometimes like they have important event and their face swells up and their eyes swell up, and they're not able to face the, they have this social stigma as well because of the lesions on their body. So patient education is plays a very major role in treating urticaria, especially education regarding observation and avoidance of the triggering factors is very essential in the treatment of urticaria. So don't self medicate. This is one more take home message I want to stress upon. Don't self medicate. Consult your doctor for proper diagnosis and treatment plan. And in case of emergencies like swelling of the face, tongue, and wheezing or tightness of chest, then immediately you rush to your hospital emergency department. That is very important. And avoid foods or medicines or pets or chemicals triggering the reaction. And reduce, because there is one entity I forgot to mention, which is like, which is called as cholinergic urticaria, where it can be triggered by emotional stress or exercise or sweating. So reducing your emotional and physical stress also helps in such cases of urticaria. And in chronic cases, we have to counsel the patients regarding the extended duration of treatment. They have to stick to the treatment, and regular follow up with their dermatologist plays a major role. So, when addressed properly, we can manage chronic urticaria as well, but we have to go together and then we can manage chronic urticaria.
Right. So a holistic treatment approach is required. Thank you so very much, Dr. Swarnalatha. It was wonderful talking to you. Thank you for your valuable time and making this session so informative. Thank you once again.
Thank you all. It was good. Like it was nice to have this session, and I hope it helped at least like few of my patients with urticaria. Thank you.
Thank you, Doctor. And viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.